following the Kear network, as we have lots of things to discuss. And so the general is here, Mr. Monique Shen, and we have Mr. Andrew Kear, James Walker, and we'll be joined today by a Liberian doctor, renowned Liberian doctor, who is providing services, medical services to Liberians in this country. And so we will cross over to the general, who will do an overview of the program this evening. General, good evening or good afternoon from your end. Welcome.
Hello. Okay, can you hear me?
Yes, you're live and clear.
Okay, thank you very much. We are very sorry for the late in transmission and because of technical difficulties, but as usual, we always try our best to come to you. And those of you who are listening by way of Facebook, please share this show. Today will be a great show. And if you listen to us on the radio, I want to say keep tuning in. Don't shut that dial. Don't turn it off. And today we're having a very good show. My co-host Andrew is in the back. And also the CEO will be on, and we'll be having a doctor who will join us. And I got two young Liberians in studio, James and Jefferson. So we want to say, please share the video. And today we have a lot of surprises, a lot of surprises. I want to tell you this before I even start. The first 20 callers today will receive $5 each. Listen, new callers, new callers. I know some of you say, but I've been calling the station. Don't worry. If you've been calling, call. Don't worry. We got surprise for you too. But if this is your first time to call and you can let other people know, we are happy to receive your calls and you will get at least $5. You all know what is $5, eh? Okay. So the first 20 callers, whenever we open the phone line, do not repeat a call because trust me, I will identify your voice and the people in studio that will tell you, say, hey, you're not qualified. So please let us be fair to ourselves. The first 20 callers today will receive. If you do it right, next week it will be more than that, and next week and next week. So I just want to tell you, please let us have a great show. The mic will be open on the same topic, healthcare is a very important topic. We don't even know where to start from, where to end, but it's so important to us that we are doing everything to make sure that everything work up for Liberians. And I'm sure that Mr. Andrew is in the back and up there listening to us. And Andrew, are you there?
Yeah, I'm here. Quickly, I was so availed
Okay.
myself. I was so availed
Okay, I
myself.
know.
I'm
Okay,
listening.
but since you there, are you ready to say something, or you still trying to get something going?
Quickly before I get all set up for the program, I mean, it's just to re-echo, previous discussions we've had. Healthcare in Liberia is a concern, just like how it is more of a concern all around the world. But for our own set in Liberia, it's a major concern because if we don't have a better health, our society, which is already struggling to some level of improvement, is going to be fully undermined. And so the repeated, discussions on these health issues is something that is, that needs to be all the more emphasized. And I look forward to a great show with the gentleman in studio and other Liberian health professionals that will be brought on board for discussion. This is just we are lifting the concern further and further for the Ministry of Health, the government of Liberia, as to how we can all trade minds to improving things in the health sector. Thank you.
Okay, thank you very much. And then again, the announcement I just gave you, maybe sometimes you ain't understand it about the $5. You will hear from the CEO himself. He will be able to tell you that yes, we are going to give $5 out today. We'll be talking the question there. This question will continue to ask. What what is your idea and what do you have in mind? How you think the Liberian health system need to work, or it is working good for us, or it's not working good? We want to hear from you. And when the doctor come in himself, we'll be able to talk to him because he's a medical doctor and he also run a little clinic, but he will be able to want to go into depth. But let me bring on the CEO and then hear from him. And CEO, you I just made a promise that any first time caller today that will make a call will get $5. And maybe they want to hear from you too. that if you make a call today for the first time on the Kear Radio and you share, you will compensate them with $5. Maybe next week will be different. So I want to give your opening, sir.
How you doing, General? How's everybody
I'm
doing? In
fine, sir.
studio, Mr. Kear, how's everybody doing? Good.
Yeah,
So
we're good.
I just want to say thank you for having me on, and Jeff and James in studio, thank you for coming on the show. Yes, General, that was my I think my pleasure, my commitment I made to the feature callers on the show. The first 20 callers will receive for $5 each. For this applies to every a new callers, not just repeated callers. Every week we're having the same amount of callers calling in every week. So yes, the first 20 callers, $5 each to replenish your minutes, your mobile minutes on your phone for calling into the show.
Okay, good. You hear that for yourself. So prepare your telephone and listen. We know the voices. Make a call. Call your friends. I know don't try to say, oh, I will not call my friends, but we want you to share, we want to be part of this whole process. That is why we are begging you. Talk to your friends, come on air, tell us, we want to hear from you because you are the one that go into the hospital, you are the one that are dealing with people. Today we'll also discuss, one of the topics we'll put it on there will be what the president said about healthcare in his annual message. He said something and James will elaborate that later on, but I'm going to turn it over to Mr. Andrew Kear, who will take it from here. Man, Mr. Kear, can you just host it for now? Let me do something in the back. And please, let's take it from there and have a great show. I'll be right there, but I got to get something going quick.
Okay.
Great. So we this is going to be a beautiful show today with our people in studio. We got yet to also receive our guests, and the concern is about health. Our Liberian people are the one impacted by the health concerns in the country, and that's why it will be necessary to just hear from, the common man out there who goes to the hospital having all these challenges, the long waiting periods, the poor health services, the issue of even how health practitioners talk to them. So, the concerns we want you to raise that we've heard a lot of people talking about, even not wanting to ever go to the hospital because of the poor services. All of these things again, the health care is not going to be perfect overnight, and that's why there is a need to live these concerns so that we can be able to also share them with the Ministry of health professionals, and that we can all be able to improve our system. Trust me, if we work together in this direction, overnight we can solve the problem. Our country is a very small country. It's all about the leadership that is required and the accountability, following up on things, how they're supposed to be done. Once we can do these common things, so much can be accomplished overnight. Let me now turn that over to maybe Jefferson. Jefferson, if you have anything to say to add on that.
Yeah. So thank you, Mr. Kia. Indeed, uh, it's good that we talk about our health matters in this country. Liberia is a small country and it is challenged when it comes to, the issue of health, looking after people. Uh, in the city here in Monrovia, you see it has become a bit challenging. I want to go back to the rural parts.
Mhm.
If things are difficult, if people are finding it difficult to get the basic healthcare delivery in the capital city, what
Mhm.
more about the people in the rural parts? Because mind you, those in the rural parts they travel from distances just to receive medical attention, and sometimes it's not easy. When some people died along the way, when they go there,
Mhm.
sometimes they're challenged, no doctors, nobody to look after them. They will only have to depend on these traditional herbs, the roots, those things to go into the bushes to at least treat themselves. So um, the basic healthcare delivery has become a challenge in Liberia. You go to various health centers, the big hospitals that we have here. You go there, man. You people, someone will tell you, well, we do not have. I mean, common drugs, the paracetamol, common drugs, these simple pills. They will have to refer you to a drugstore to go and purchase them, whereby you're just supposed to get them from the very clinic you've gone to. So it has become a challenge in Liberia now. People will die from common sickness. Sometimes people just die. It's not that the sickness is that big, but from just little thing, people die. Imagine people dying from typhoid. Typhoid that you could just, I mean, could just be treated quickly, but because there's no proper, care, no medical attention, all the hospitals they lack medical equipment, and so people will continue to face these challenges. So the issue of health in our country, the basic healthcare delivery, we not is Nigerians are not actually feeling the impact of these things. So it will just come to the extent that everybody will just feel reluctant. Well, I'm sick. I don't want to go to the hospital because even if I go to the hospital, they will tell me to go and buy some kind of, I should go to one drugstore. And so I would just decide that let me just go to the drugstore. I don't need to go for a checkup. Let me just go and get paracetamol. You don't know what is in you. But when you go to the hospital, nothing there. And honestly, it has become a serious challenge to Liberia in this country. The issue of health is something that we need to keep talking about. Maybe the Ministry of Health. Some days we hope that practitioners could come here from the Ministry of Health. We talk about these things, but Liberia, our health system needs real reform. It needs reform. The health sector needs reform. Honestly, Mr. Kear.
Wow. Oh, it goes without saying. I mean, I don't have to live in Liberia to know exactly what is obtaining, and that's why we will make this a repeated, call to the rightful authorities to come in, to hear us, to hear people out. Um, Another thing that was also talked about, and I look forward to seeing how we can highlight the president's speech also on the issue of healthcare, so that we can also make some comments into it. I'm also expecting the one of the medical professionals or doctor who's supposed to be on it
Yeah.
this evening to be able to also expound on some of these concerns. Like I said, it's not going to be perfect overnight. But what is of concern and as to why we are doing this is that you still have the gaps that are still there. The gaps to the point that even things that should not be able to even kill people, sicknesses that should not be able to lead to any fatal you call consequences, these are happening. But until we can make these calls over and over, we look forward in the future where the Minister of Health, we will reach out to them, we'll reach out to the rightful authorities, because these are the people in whose hands the president has also placed that responsibility to coordinating that leadership in the health sector, to making sure that the requisite health professionals are in place. Because there is also a concern where the etiquette, even among the people or the medical doctors, their non-professional approach to patients even tend to add more problem to the patient's problem. The way to talk to the people, you should be more receptive. Again, this is not a forum to demeaning or to criticizing doctors. There are ways out to dealing with situation, and so this is not just about the doctor, but all health practitioners making sure that our society well-being is in their hands. Also, what is required to support this sector, the medical sector, be it the medical equipment and other supplies that are needed, that the government be able to also work with its own agency of health to making sure that these challenges are mitigated. And that's why we are here to lifting these concerns. I might want to also turn this over to my CEO, Chris Kear. Maybe you have one or 2 points to add before we go further.
No, thank you, Mr. Kear. No, actually, you said it all, to be frank. healthcare has to be the priority for Liberia moving forward, because our they say no good health is not, there's no wealth with no good health. So if we prioritize our health system in Liberia, we can be able to have a good health. The citizen of this of Liberia has they have the rights and to a good healthcare system in Liberia, because the government has to take the initiative to do so. If the government is not leading, we can't do anything. Like, we actually want to see a better Liberia and a good healthcare in the country for everybody. We don't want to see our people going to the newer countries to seek, medical, attention and any other thing. We have to do, better as a country. And in order for us to do it as a nation and as a society, we need to put hands around each other, for the government side, the private sector side, and also local NGOs to be able
Yeah.
to help to build a very supportive healthcare system that will serve everyone in the country. So yes.
Jefferson, you will be looking at some issue with respect. I mean, you will highlight some points I think that the president talked about. One of the major concerns and one of the issue I think the president talked about to had to do with the issue of mental health. Mental health is another critical concern in our country. With that, you have most of these folks that end up in the ghettos, like the Zogos. This is a major part of our society. That's that sector of our society is a human resource that, if not looked after carefully, as much as we are talking about the same health concern, but the mental health is another challenging concern that we have in our country. What you guys are on the ground, and we hear all the stories. Just give me a little idea. What does it look like, and as to what we are faced with in our own country, Liberia? Jefferson.
Yeah.
So,
Okay,
okay,
James, you want to come in? Yeah, James.
yeah. So, I've listened to all of the points, and then it's a good thing that we talk about health as we've always done on Kear Radio 95.9. But I also like to divert a little bit. We have talked about some of the challenges, some of those barriers, some of those things that affect the patients or Liberians when they go to hospital, some of the things they encounter along the way. But there has been a little step, of progress, some steps of progress, I believe, that have been done over the last few months, recently, especially during the week, by the Ministry of Health to boost the health sector. There have been some level of improvements, a little, as the people can say. The journey to 1,000 miles begin with one step. So
Yeah.
yeah, I just like to highlight some of these things, so that people can know that in as much as there are numerous challenges, there are numerous of things we are encountering, but there are also little steps being taken to address some of these challenges so that Liberians can have access to affordable health care services. So the first thing is there was a donation made by the Ministry of Agriculture to the Ministry of Health for patients. The donation of 100 bags of 50 kg rice, for patients to provide food for them. And this also, as a means, boost the agricultural sector. Imagine we are producing locally made rice or produced rice, and
Wow.
then 100 bags of that particular produce was donated to the Ministry of Health to help feed patients at different health facilities. And also, WHO also donated assorted materials to the Ministry of Health earlier last week to help with some of the treatment, to put the equipment, and that is to help with their blood transmission programs, and also the refrigeration equipment and other equipment that was donated to the Ministry of Health to help at least boost the enhanced healthcare delivery rather, and also there was 4 health facilities that was renovated and turned over to the governor of Liberia in Grand Crew County. So
Great.
yes, so 4 health facilities were renovated and turned over. This was done by the World Hunger Life, and it was being supported by the German government. Yes, so that project was being supported by the German government to help improve the lives of Liberians in that part of Liberia. And also, there's been a solar plate or panel rather being installed currently in Sano County, and is I'm told that it's nearing completion. So that will help to give electricity to some of the clinics or the hospitals on that side of Liberia. Sano County, Grand Crew County, Grangela County, those are counties that are in the southeast, and we can say hard to reach counties. To get through to those counties is very difficult. Sometimes the distances between the hospital and then the different towns and villages are far apart, and getting healthcare services, in those areas is a real challenge. So to see this kind of development going there, at least it's a little step taken, as I said, towards improving the health sector of Liberia. And also, these are some of the things that are happening. I look forward to us talking about the president's speech, where he mentioned that he said he has provided some equipment of medicine to all public health facilities across the country. That is something that we need to fast check to look after, to follow up.
Some technical problem. James, we're not hearing you very well. Can you hear us?
I can hear you.
Yeah. You can hear me?
Jefferson, is there a problem there?
Are you people getting me now?
Yeah, we get
Yeah.
you.
Not yeah.
Yeah, so I got to
Yeah, we lost
just,
him again.
as we talk about the challenges we also good to talk about
Oh, okay. I see where the problem from. He got us.
the progress.
Jefferson is the one that switched over. Continue.
Yeah. So that's just some of the progresses we have made, over the time, and yeah.
We definitely we must give the government a pat on the back, and like I've always said, and these platforms are not meant to place government on the cross to crucify them. It's only holding the government's feet to the fire, and all other partners in progress with the government to making sure that we all are trying to watch out and lift issues so that they can be addressed. And I must admit, I mean, the government is making some baby steps. Just the other day, I think that was the 22nd, right, when the government had just celebrated a year in office, right?
Yeah.
So I mean, that's a major pat on the back, with steps being taken, and I love the consciousness also for them to be able to listen to and then try to prioritize what is very key in terms of its developmental agenda. And we will be looking at some of the things that the president discussed, especially the health concern aspect of it, so that we all can make further comments to that. And I look forward mainly to the medical doctor who's supposed to come online and see what we also will hear here are, because they are the people who get really like heated by the citizen with respect to the level of services that are being performed in the field for now that they don't feel satisfied with. And so, let's discuss these things and be able to make an input and other recommendation to the Ministry of Health, and the government of Liberia. Chris, you want to add one or two things?
Yeah, so yeah, thank you for the point you made. Yes, we have to take a huge step in, working on the healthcare system in Liberia. Like, this is not a trap for any government official to say, I don't want to come on the show, because I think Jonathan told me that some of the government officials that he talked to, some of them are very afraid to come on the show. They don't want to get in, any trouble with the government for saying the wrong thing. It's not. This is not about saying the wrong thing. It's about doing the right thing, right? So we have to work together. We have to. Like, we want to hear from the government. What are some of the steps? What are some of the uh, the plans they have in place to help this dire healthcare system to become modernized, like other Western civilizations healthcare system. So we just want to have a dialogue to see what's going on, what we can do as a society to make this country's healthcare system, a better one for everybody. I know that common diseases or sicknesses will not be killing, citizens in the country, including the government officials, for them to be flying, out of the country to go, for any, medical attention. So
Yeah. So,
Sir?
see you. I think the doctor is having a little difficulties in. He wants me to connect with him. So, James will take over while the conversation is going. Let me just give you a little instruction, tell you what to do so that he can come on.
yeah, sure, go ahead.
Okay, James.
General, you there?
Yeah, I'm here, James, and you got to. Okay, don't worry. I know what to do. Okay, just keep it like that. I'm going to.
Generally, you just want to remove me.
Yeah, I
So I
trying
can
to
get it.
remove my. Okay, James, can you talk there because when I remove you, then I see that uh, uh,
Oh, okay.
uh, uh, James is. It look like you switched the mic around. James,
Yeah.
can
So,
you hear us?
Yeah, I'm getting you. Are you getting me?
Yeah, we're hearing you.
Yeah.
Now you see you can hear us again.
Yeah, sure. Line clear.
Okay, no problem. I know what I'm gonna do. Okay, don't worry. I know what to do. I'm gonna put you back. Put everybody back. Okay, go ahead. Let's take it from there. I know what to do from here.
Yeah, so I don't know whether we should go to the president's message or we can just.
No, just go ahead with some of the key points that he made in concerning healthcare.
Okay, sure. Let me just get there quickly.
So my question here is: did he see the need to prioritize healthcare system or the healthcare needs for Liberians? What was some of his plans in doing in deriving a modernized healthcare system in Liberia, or taking some steps towards it?
For
Yeah,
James, before you just come in, for me, I mean, I haven't read the speech as yet.
Myself,
Yeah,
I just saw
so of course, definitely, the health concern of the country is a priority to the president. One of the I think the I just briefly was listening to the program, and some one of the points he talked about had to do with mental health, and I was very impressed with that. And we look forward to seeing how that can be fully engaged by the stakeholders in the process to attacking such a major concern. So, just from the top of my head, when it comes to the health, I mean, that was a major issue of concern to the president and for all presidents over the time anyway. So, but it's about how well can this be implemented? How well can we walk our talk? I think that's the major concern.
yeah. So, like, Mr. Kear, what you said, what you just alluded to, if the international community cannot see us doing something on our end, I don't know why they will keep giving us money to better up our healthcare system. If we're not doing, we the ones to start the
Mhm.
process of doing, to modernize our healthcare system
Yeah.
first. Like I said, money is not an issue in our country. To be very honest with you, so we can do something for our end, and wherever we shut off, we can reach out to the international community and say, listen, this is what we want to do, but this is what we
Okay,
have
I
done,
think
what we want to do.
he's trying to come on.
So
Yeah, Yeah, go ahead, sir. I see he in the back. I'm trying to see if he can
Yeah, yeah. The
come
doctor
on.
is trying to come on.
Yeah, it's not easy. Not everybody know how to just get on like that. And if it's not going on, maybe we'll have to send the key back to him. Maybe it been over the time now because sometimes when he stay with you for some time. So let me
Yeah,
see.
I
I
think
can
you have
if
to
we can.
resend it after
I
30
will send
minutes.
a new key to him. Yeah, yeah. It
Yeah,
been
I
yes,
sent it to
yes.
I sent it to his WhatsApp just now as well.
Okay, I'm going to send him a new one again if he can't get because I can't bring him on. I see his slot in the back there open.
Device is
Okay,
not
it already generated a new key, so I think I have to send it back to him. It generated a new key already. So
Yeah, so yeah, that's
y'all
it.
continue, continue.
Yes. Yeah, so in the president's message, he talked about key things. One of those things he talked about maternal mortality rate.
yeah.
He also talked about drug in the at risk youth. He also talked about a 16 million deal between the Liberian government and the Chinese government to construct, a national
Rehabilitation
clinical
center.
and diagnostic laboratory at the 14 Military Hospital. He also
Wow.
talked about, helping all Liberians to get treatment for a particular cardio sickness that he was being affected with, and also always the president expressed his commitment to improving the country's health sector. But the question that may linger in Liberians' mind is how long do they have to wait to see these things being implemented? How long is it going to take for these projects, these different promises, or these different things that the president mentioned in his speech? How long are they going to take effect? Because for more than 10 years, we have heard presidents pass in the past making speeches assuring Liberians of affordable health care system, access to good health services. And, all of these big speeches and things, they are now Liberians, and I think Liberians are now looking forward to seeing the work, the tangibles. If you say, for example, if you say the government of Liberia are going to construct a rehabilitation center for at-risk youth or disadvantaged youth, that should be done. I know these projects do not just happen, but it should not take the entire 6 years of the government for that particular rehabilitation center to be constructed. It does not have to take additional 6 years again for uh, a considerable amount of youth to be rehabilitated from the drug abuse and others. It also does not have to take a whole 6 years again for the government to rebuild or renovate and at least provide medicine for some of these public hospitals, especially the ones in the rural area, because it is very challenging for them. Sometimes you go there, you have to get on back. Imagine a pregnant woman will have to leave from her house. Sometimes they walk because you barely find a motorbike or vehicle, plying that route. It only happens sometimes when people are moving, like from maybe if you are moving from, for example, Monrovia, you want to go to Banga, you have to, the car has to get full with good amount of people before the car leaves. So if that doesn't happen, you don't find a car on motorbike flying that particular road. So that pregnant woman will have to walk or sometimes use other means to get to the hospital. And the distances that are there, I mean, it's just far for a pregnant woman to induce such pain to go to hospital. So Liberians are now, I think they are now looking forward to how can these promises be seen? How can they be brought to reality? It's no longer about the speeches because after all of the long speeches you make, the biggest question would be how have you impacted the life of Liberians? You cannot come and tell us, for example, you said there's a little over 60% of infant reduction in infant mortality, right? For example, and then yet they say you go to the hospital, you still find babies are dying because of very, 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 very common
Mhm.
treatment that they are supposed to receive, but they cannot receive it because there's no equipment, there's no medicine, or some other problem that has happened,
Okay.
that they cannot get it. So the essence
Okay,
is,
we got the doc in the back,
Yeah, the
and
doctor.
he's on yet. So I'm going to bring him on, and please let's all welcome and the doc. And I think maybe he's. How are you, sir? Welcome to the Kear Radio, Kear Network Communication, and the Kear Humanitarian Organization. How are you, sir? And can you hear me there?
Yeah. Where are you?
Dr. Julius?
Yeah, I'm getting you.
Okay, you just little low. You welcome to the show, sir. Hello.
How they
I think I think it is the network. Yeah.
I think it's
Okay, and
camera is
Jeff, you
still
want to talk to
fixed.
him in the back there on the
Yeah.
phone and see if he can. I heard his. Okay, I think I see his stuff blinking, so that means he's trying to
He's trying
switch
Yeah,
to
on.
hello.
position. Yeah,
Yeah.
Okay,
Dr.
I think we
Julius?
can hear you now. Yeah,
Hello.
yeah. Hello,
Dr.
we can
Julius,
hear
can
you.
you
Can
hear
you hear
us?
us?
Yeah, I'm getting you.
Okay, welcome to the show. I'm trying to introduce you to
Hello, Jeff.
welcome and meet the other guests. To meet
Yeah,
the other
Yeah,
yeah,
guests.
Dr.
I'm here. I'm here. I'm getting you.
Okay, Dr.
Okay, I say
Julius,
welcome.
this is what you can do for us.
Yeah,
If you if you
I've got a
just
link.
yes, so thank you. If you would just tell the people in the background, to just or maybe you just move a little bit so that we don't get distracted because you're on the radio as well. Are you getting me?
I think he's having network issue.
Yeah. Dr.
Okay,
Julius, are you
let's
there?
go.
Okay, let's go ahead,
He
James.
just he just went off. Okay, continue. Let's continue.
yeah.
Yes.
So those are some of the things that were mentioned. But then, as I said again, you do not just make the beautiful speeches these days, because Liberians are yearning for
Answer.
realities. They are
Yeah.
going for the tangibles, because if you come and say, you're doing this, they want to see what you are doing.
Implementation, in
They want to
fact.
see the project. They want to see the visibility of what you are saying. You can just come, yeah, yeah, we have heard these beautiful speeches, but then again, like I said, you see, they talk about 50 acres of land in Bentonville for at risk youth.
Rehabilitation center.
Yes,
For,
but then I think that was broken. That
yeah,
particular place was ground was broken. I think last year.
it's been long overdue since the government made the pronouncement. It broke grounds and all for that rehabilitation center in Benson. But up until now, we cannot see anything. So the thing that, like James was just saying, the speeches will be made. You will tell the people, but the implementation of these things, once the people are not seeing it, they are not getting the actual benefit of what you've said. I mean, it will just be like it's being swept under the carpet. You know, promises will be made. You will say we'll do this, especially when it comes to
Okay,
health. Will
James,
be
Jeff, we got Dr. Julius
yeah.
on here again. How are you, sir? Welcome to the Kia Network,
What happened to
the
the
Kia
camera?
Communication FM 95.9.
Dr. Julius, can you put your camera on? Yeah, just put your camera on.
Okay, let's continue. I think you're having a network problem or something.
Yeah. Connectivity problem.
Yeah.
Yeah, so basically it's just it. It's not just about making the speeches that you build this because Liberians people fly every now and then to go overseas to go for treatment, and then why? Well, I mean, the country is rich, and then promises will be made. I mean, we just need this basic equipment in our various health centers, the Jackson Dome, the JFK Redemption. Now go to Redemption. When you enter Redemption, you feel so bad. you will feel bad to the extent that while redemption that is as old as what, and people will still be suffering from this simple treatment that doctors are supposed to treat people. And we have trained medical doctors in this country who can just look after people, but the basic equipment we do not have them. We don't have them. Sometimes even when the drugs come in, that are supposed to look after people, to treat people, to be given to patients, the drugs will be diverted
Yes,
to.
we can hear you, Doc, but you're very low. We can hear you. We try to introduce you, but you're showing. And what happened with your camera?
Yeah,
Dr. Julius.
let him work. Let him work on it in the back, so we can continue the discussion.
Maybe
But
you could just call somebody that will help you, doctor. Somebody there in your area who will come and just show you how to work. To just put your camera on, it will do you good. Yeah. So uh, when the drugs come in and then the drugs are being diverted to private clinics, I mean, it becomes a challenge. That's why you see when you go there, they say go on this side, and they give you a specific clinic where you should go and get the drugs, which is very wrong. It is very wrong in our society now. So our health sector, with all the policies, with all the statements that the president will make, bringing in this, if they, I mean, once proper care are not taken, it will just be a mere statement. People will say, "Oh, the president has said this," but nothing will be done. And so the center the president talked about, the rehabilitation center in Bentonville, it will be good if it works out because the city now, the at-risk youth, there are many in this country, in this city. If you get rid of all of these people and just take them in Bentonville, it will do the city a very good thing. But if you just say you're better and you get better, then well, we will just be here and we'll keep talking this thing over and over and over again.
But just what you're saying, Jeff, about the equipment and the kind of health services we provide, right? There's a story here from West Africa that talks about a family filed a lawsuit against JFK.
Yeah,
But the same thing that happened to Amara Kamara, almost like not the same thing, rather, but almost the same thing that happened to the boy who died from, I think, as a result of malhandling or maltreatment or ill treatment from the Catholic hospital.
Yeah.
So the family claims that the doctor there mishandled that daughter rather, and then because of that, it led to the death, of very young Liberian. Imagine she was 32 years old.
Yeah.
And then she was 26 weeks pregnant.
Yeah.
So imagine that situation, right? A pregnant lady went to the hospital to get a treatment, but then she could not get it because of some mistakes from the doctors there, for which the parents are claiming.
I think he's trying to say something. He's trying to say something. You can hear him.
Dr. Julius, are you there? Hello, Dr. Doug, are you there? Can you hear us?
Is it possible for Dr. Julius to call in the studio and then he can call the replay, we can be able to hear him loud from there so that he can make his points.
Yeah, so I think I can connect him through WhatsApp from here.
Be better that way.
Yeah.
The video is not working.
No, it's not working. I mean, we can talk to him behind camera. It doesn't matter.
Yeah.
What matters most is his own input with respect to the challenges on the ground.
So
yeah.
I'm trying to connect him through WhatsApp.
Let me get out to what the two previous callers were saying. Jeff and James made they made some prudent points. Yeah. But what I try to say here is the contrast to what you guys were saying, right? The government has to do more as well, right? As a head of the country, we have to prioritize. Healthcare has to be enshrined in some way, to get to some point that we, like I keep saying on the show that money is not an issue in our country, right? If money is not an issue, why is the problem then? What is the problem? Because I think the resources are being diverted for another purpose or purposes, and the key benefit of healthcare and other sectors they are not being met. because the government will have enough money to have our
I think, I think Dr. Julius has joined us through WhatsApp call. Dr. Julius?
Yeah, I'm online.
Okay, he joined us through WhatsApp. We could not get him through StreamYard, so he's on WhatsApp.
And he's very low. He's very low too. So,
Doug, are you getting?
Yeah, I'm getting a communication.
Okay.
See you getting him?
Yeah, okay.
Getting him?
yeah.
Sure.
Welcome, Dad. Welcome.
Dr. Julius?
Hello?
Yeah, you're live.
Yeah, I'm getting you.
Okay, welcome to the show.
Okay, I'm getting you.
Welcome to the show. You just have to.
Yeah.
You just have to leave the noise a bit. Then please tell your. I think I don't know whether you are at the clinic.
Yeah, I'm somewhere in the community, but I'm at a quiet spot. I don't know whether you are getting feedback from my location, and then you got to communicate that to me.
Yeah, we're getting feedback. People from in the background. There are people in the background.
Okay, let me work a little bit.
Yeah. So Dr. Julius has joined us.
Yeah.
Okay.
Yeah.
Thank you so much. We're good now.
Okay.
So this is Kear Radio 95.9 Kear Network, and you're live on the conversation with the CEO. It comes on every Sunday, 7 p.m. And today we have our CEO, Mr. Christopher Kear, our Chief Administrator, Mr. Monique Shen. We have Mr. Andrew Kear as well. James and I will here on the conversation with the CEO. Today our topic is a general topic. It's open. We're discussing healthcare. So welcome to the show, Dr. Julius Pratt.
Okay, it's a pleasure meeting you guys in studio. I could have not been on stream, but unfortunately, due to internet inability and other condition, I'm not on stream. But I feel comfortable discussing the issue once it comes to health matter. Our study and our practice is health, strictly health. So we feel very interested in discussion of this nature. It's a pleasure being with you.
Thank you.
Thank you. So you will be able to, I mean, he can hear us loud from here too. He can hear us.
Yes, I'm getting you.
No. Okay. So Dr. Julius, we've been discussing this issue about the crisis of healthcare system in Liberia. Our country is actually at a critical juncture. That is so marked by a series of systemic failures, to the point that it has really increased preventable mortality rates in our country, and most of such, many have also viewed that, and from studies, from compromised well-being of its, from the compromised well-being of its citizens. With such concern raised with the Minister of Health in the past, there are common issues about, poor customer services that people receive in the health sector, the long waiting time, the poor communication with respect to how health practitioners interact with the patients, that disrespect and lack of empathy, and so many challenges they've had. Also, the issue of lack of equipment to help in the healthcare sector. There are a couple of them. I know you've been in the healthcare sector, that you've also been able to face some of these things. What is your input with respect to these challenges, and what could be the way forward?
Okay, these are very brilliant questions. We have had variety of challenges. Basically, dealing of our country is challenging to the extent that people wanting to go to the health sector have to be schooled, and the challenges of entering health institution, the medical institution is a great challenge. You know, uh, institution called TNINA, and you know the history since the rise of ages, TNINA been existing, and that institution have been on a very low level. People attend there and they don't receive degrees. It's challenging. And getting into the health practice itself, we are in a computer world. Everything is being digitalized, and then we are in an AI world. Like for sure, we are in an AI world. And in Liberia, majority of our practices is just manual. So I think we have to move to a little bit of advanced level where these manual practices of our health practitioner can really be improved by going into the can be attributed to this high rate of death among our childbearing mothers. First of all, a very low grade of practitioner that's shown to work. Meanwhile, TTM, and this TTM is very scarce for them to receive training. Some of those equipment they used are not being sterilized, cannot be sterilized. There's no monitoring.
I think you want to shift a bit.
Yeah.
Of Madam Eddie Johnson, and not during the regime of Madam Eddie Johnson, there were a series of coordination where TTN.
Doc, your network is bad. You want to shift a little bit.
Wow.
Yeah, your network is bad. You're coming in distorted. Yeah, I think he's having network challenge in that area. Yeah.
Yeah, and he's stretching a lot of good points.
Okay, I also have
Go ahead. You say your network is bad.
Are you getting me now?
Yeah. Go ahead.
Okay, so like I was saying, we have the TTM system that is not being monitored, and when we talk about maternal death, we mainly experience this from the traditional male practices. So I think central government need to look into that direction. I mean, those are people that had the inspiration to enter the field.
Wow.
So, so what I think we can do now is to put into place a system where these people practices can be monitored and regulated, and sometimes maybe transferred to a health center so that we can reduce this really health thinking. Sometimes can be dated from the school of orientation. You have to understand that once you try to be a student by wanting to go into the practice of health, you have to be sure. That because we have students are there. When you leave from there, you graduate from school, you are a diploma, you are going to citizens of our country. Perhaps maybe aliens that visiting our country, they get sick, they go to the hospital, and the practice that we are going to the safety of students when they go out. So, in recent times, we always saying that the majority of the patient population complain about going to hospital, nursing stockings, and not focusing on their health conditions. It's just it's participate privacy, but we have to do a joint MOU where people from the government sector, institutions are responsible to train our health workers, institutions are responsible to carry on health practices, so that people can work in Ghana. Once the coordination is there, everybody knows their responsibility. I mean, we can minimize some of these challenges. Like the senior guests have directly said, when we talk about maternal death, I mean, I think we are at a higher peak at time. We go at a higher peak because the challenges are there. The challenge is uh, uh,
Okay.
An institution that carry on the meeting does not have an ultrasound. Perhaps no electricity. So when they will be and how do we know that this building is our general stage and maybe this building another
Yeah.
It's
much of the child time the child very another time in facility before we uh, after 2 or 3 days trying to repair this station. When we get to the repair facility and it's late, sections are become the get there and it's the fix. Yeah.
okay. In the meantime, just shift a little bit while we go back to our overseas guests, so that just shift a little bit so we can get you better. So, Mr. Kear and CEO.
Yeah. Look, Dr. Julius is making a lot of points. Um, even his comments speak to the practical issues that we've been talking about, and it tells me that he's fully aware of what is obtaining in the country and the gaps even in among the medical practitioners or the health professionals. So this is not in any way to defame the the sector or the services that they are rendering, but it's about those gaps that he believes also that could be worked upon. Um, I know his colleagues are listening to him, and other health practitioners are also listening to him. But I will want in the future that we can invite him on in a studio where he will be able to explain better, so
Yeah,
that
yeah.
even the man matter who in the interior can hear him out, or those in Painesville, or those in Cape Mount and Grand Bassa. These are challenges that are common that come across the country. Um, what you see being experienced in Monrovia as a challenge is even more worse in the hinterland. And
Mhm.
so these are things that we all need to lift, so that the Ministry of Health, the government of Liberia, the health practitioners, all of them can all see through these things. Unless you are not being human or morally inclined, you would think that Dr. Julius or others are more or less trying to bad mouth the Ministry of Health. No, it is about those leakages that are there while the government is making some efforts. Mind you, efforts that government is making, and you got others who are only there for the money making concept. They are only there to undermine the system. So as a result, on the overall, it affects the entire healthcare delivery. So these things, the concern need to be lifted so that even those who are involved, they can hear these things and say, I think what we are doing, or even my role that I play that may be negative, it goes a long way and it affects other people because of maybe my wrong role play. Others died along the process. So we are only trying to speak to the consciences of people, speak to the consciences of the medical sector, speak to the consciences of government, the Ministry of Health, so that we can improve our system. I want to thank Dr. Julia. I know he probably still listening, and we
Still
look
listening.
forward, we look forward to having him merely in the studio so that he can better lay out things that his colleagues can also hear out, and that we will also be able to have other health professionals to come and speak to these things. There are a way out to solving the problem. There are a way. So let me stop here for now and hand that over to General. General, are you there?
General?
Yes, I'm here. I'm listening to everything. I just trying to do something in the back here. We're trying to set up something
Oh,
concerning this whole show. But
okay.
Dr. Julius said it well. I'm sorry that his telephone is not too good. Like you said, we need him in the studio. But let me ask him this question. He said everything, but Doc, you run a clinic in that area. What are some of the problems that you hear from the Liberian people, your people that you serve? Because I did a research that, and I think Sir Joseph, one of the person who continued to help you, and Madam Salif did it before, but since then, there's nobody, and they say other people come in, sometimes they don't have money. What are some of the problems that you, as a clinic owner, what are some of the problems in the area with your citizens?
Dr.
Is it there?
Julius?
Yeah.
Dr. Julius, are you there? I think he's muted. Dr. Julius,
I
are you
think
there?
I think we really need to bring him in studio. We need to do
Yeah.
something. Maybe Jeff, if we can bring him, you will have to go there
Yeah,
and
I definitely will.
and
Let me try
get
to
him on
reconnect.
because I know the time sometimes will not permit him. But he said some lot of things that we need to that the people need to hear and want to see his face or his
Yeah,
presence
so
because
Dr.
it's
Julius is
very,
back.
very
Dr.
important.
Julius, are you there?
Yeah, I'm getting you now.
Yeah, so General, you want to ask the question again?
Yeah. What are some of the challenges? Because people
Yeah,
come to
yeah,
your
yeah.
clinic every day, and what are some of the things you hear from your people when they come there? Like no money, and you still give them a free treatment. Like if they come to your place and there's no money, do you give them free treatment, or do you actually take care of them and later on bill them? How you do that?
Okay, let me just share this recent scenario with my studio guests and the listening audience. Can I share this recent scenario?
Yeah,
Yeah,
sure,
sure.
sure,
Yes,
sure.
go ahead. Yeah.
Hello?
Yeah, go ahead, Dad. You're
You're
live.
live,
Go ahead
you're
and
live.
share.
Hello.
Yeah, go ahead.
The scenario is like at the get-go, this lady had a clash with one community dweller, and then she went at the police station. And so when the police went there, they apprehended the boy, they took him to the police station, and so he decided making himself and went just making money in the community. When people saw him, as usual, they started calling him thief, rude, and people went after him to mock him. And so the same police had to go there to prevent the mob justice that was needed against him. They took him to the police station, but then he was almost in semi-coma. Police decided to take him to our facility. At the facility, they tried to make some search to get his family involved. And when the family came, they told the police directly that, when they went to arrest this man from the house, he was conscious. He was conscious. And now people brought us to the clinic, and there he is. He is in a state of dilemma. So when we presented the bill to either the police personnel or the farmer,
Mm.
no, Human Nekoku, 40 policeman, he said, look, what I think I will do, I will pay this bill and then we'll do the investigation after, then whoever is being charged as wrong will do my payment. But there is just a civil scenario. Most often, neither the parents nor the police will pay, and then the institution just goes zero balance with drugs use. And then we have limited philanthropic attention when it comes to assessing the institution, the medical aid, medical equipment is a challenge.
Mm. Wow.
Teachers, when it comes to cleaning matter, we face. Before that, we used to have this program controlled by the Malaria Control Division of the Ministry of Health that used to normally give medication to other public facility and private facility. But nowadays, I don't know what is happening to that program. People are not benefiting from, those services again. And my second scenario have to do with the 2014 Ebola episode, where when government started to approach the situation, it was like public facility based. They directly forgot about the institutions that private citizens.
Mm.
So at the end of the day, we have lots of people being affected by that Ebola virus from the public sector because the government was not focusing. And then I did a special survey and I realized that majority of those people that got infected by the virus came from, centers where people have limited knowledge on training materials about how to prevent
The Ebola virus.
epidemiological problem that we have. So I think we really need to go back on that drawing board, not to forget, once you are approaching health, you have to do it on a holistic basis. Though you have your own government facility that are catering to citizens, equally so, those people who are running private institutions trying to buttress government effort, don't forget them, include them into your
Sure.
them because in the overall release your citizen and release us. Now the people are those centers, so you have to include everybody.
Mm-hmm.
Think about make sure you call private institution to train your staff. When there is a benefit, try to include private staff to motivate them because at the end of the day, we are talking about one Liberia. So when a single Liberian dies from a private sector facility today, is a Liberian. From the public facility is a Liberian. So the government need to work hard to make sure that we have a
Okay.
that has been a very great challenge. The government is trying to do their best, but not.
Mm.
Yeah.
He's
Thank you.
making a lot of
So
points.
take it from there, Andrew. Take it from there. Save trying to do something.
Yeah, there are a lot of salient points that he really put forward, and I was just listening to him. And one of the concerns that we've had to do with the the quality of medical staff and how they approach even their patients with with health challenges. Now, when you are schooled from the from this health perspective, you are coming in as a hope bearer for those who get affected. Now, but when you come without, you come with such a mindset, it's like I'm going in the field for money making. Yes, every career has its own. It has its own, financial benefits in terms of how you get compensated and all of that. But for the health sector, trust me, most of my family members are in the health sector, doctors and nurses. So we being administrators, we're seeing the relevance of it and having and also working in the health sector in this country. I do see it. It has to be with passion. It has to be with concern for the people. It has to do with going beyond your call of duty and being patient to listen to people, or else you will definitely approach your profession with such reckless attitude to a point that it's just about money making, and then you don't pay attention to your patients. You don't have that professional posture when they come to you as to how to address the issue. So most of the problem, the Ministry of Health is there, the guidelines are there, the protocols are there, but it's about also the implementers in the field, the health practitioners who are in the field that need to be trained in that direction. So he talked about capacity building, and it's very key.
Hmm.
We have to be training people over and over and over. Beside what you know, you also have to be trained on the etiquette that is required, the professional attitude that is required, and how to conduct yourself to be able to deal with patients. If you don't do these things, they undermine the level of communication that is required. They undermine the level of service and quality of service that is required, to the point that you break trust. And when trust is broken, patients do not have trust. When they don't have trust in you, that confidence, it tends to raise a level of fear. Like in the past, we've heard other people say, "Well, I prefer to even die at home than go to the hospital." That's a confidence issue, and all of these things can be well pruned, groomed every day through repeated training, guidance, and then leadership. So you also need that leadership and accountability in the health sector. I know other sectors need it, but today our concern is about the crisis in the healthcare sector. So all of these key things that we've talked about and the doctor also highlighted, if only leadership can listen to these things and also place that into their capacity building programs. And then another thing that the doctor talked about, which we even talked about last week, is that the health ministry cannot do it by itself.
Hmm.
You got to work with community programs. There are community programs that are set up. The private sector, the healthcare providers, they are out there to meet you halfway. Now, but if that structure is not seen for your side, for the Ministry of Health, trust me, the other private community will be doing their own thing. And mind you, they are mainly for profit making. But
Hmm.
if we do not set a system that is more equitable and professional, and only for that is there for the well-being of the people, the entire idea of healthcare delivery will only boil down to money making. And that's how you see most of these clinics that are being created. Even when you go to the hospital, someone is giving you a prescription, they're sending you to another doctor who,
Yeah.
who business has to be promoted more and more. And
Mm.
at the end of the day, you tend to create some monopoly even in the dispense of medical services. But if the Ministry of Health does not look beyond these things, or does not take note of these things here, trust me, it's going to be a problem that will undermine the good services that they intend to give to the Liberian people. And at the end of the day, there is this rush of making reports that you tend to just give a report for report's sake. In the end, it's like, have you been able to? to really accomplish what the goals were set for. And at the end of the day, maybe the Minister of Health or another sector will give their report that is so much, is so appeasing, and then it become part of the president nation address notes. So we were talking about all of the good things that the president said that will be happening. But all of that is also contained in some of the things that probably were presented by those sector ministries that probably were not even done.
Mm-hmm.
But we
Yeah.
are so the health sector, even for it to be able to help the president, it has to create that information system, that monitoring system with respect to those gaps that we are all highlighting. Because when you do these things, you help the ministry, and that the Minister of Health will be able to speak to those realities and ensure the control measures that are needed to be in place, so that everybody go by that. So if the health minister sits in there and set the protocol, the rest of the team will follow. So we look forward to seeing more people coming, so that when we talk about the healthcare delivery system, we need to be able to say what works. We need to be able to put out what is real, so that even when we are discussing these things, they don't sound like a mockery or a laughter to our own people, to their well-being. I think that's where we are, and it's good that we continue to be, let it be a town crier, let us be a wake-up call, let's continue to highlight these concerns. Our society gradually will definitely make progress, and we're looking forward to what the government has said in terms of the health sector, the mental health, the mortality rate to be decreased to a level that will enhance the society. We are looking forward to all of these things, but we need to walk our talk. Studio?
Okay, so I think I have a few questions for Dr. Julius. Is he on the line?
Yeah, he's still here.
So, Dr. Julius, where do you get? I already talked about, I think, insufficient resources. So, where do you get maybe finances from to fund some of the treatment you carry out, or some of the surgeries or whatever you carry out at the clinic? And number two, what are some treatments do you provide for Liberians at your facility?
I think a call coming in. Go ahead. There was a call coming in.
Yeah, my two questions. The first question is,
we're getting feedback, Dr. Julius. We're getting feedback. Okay, you want to get a question? Okay, go ahead, James.
So my first question is, you talk that
we're getting terrible feedback, Dr. Julius. We're getting feedback. Yeah? Go ahead, James.
Yeah, my first question is, how do you get the resources to fund some of the treatment or some of the equipment, that are purchased by the clinic to carry or to provide health care services? And then the next one is, what are those treatments or services do you provide at your facility?
Doc, did you get the questions? Is reconnecting? I think it's network. Yeah.
Yeah, it's a problem today.
Yeah, the network is a challenge.
You have to do something to bring him in studio.
Yeah, I definitely will see you. I hope to bring him next week, so that he can be here in person.
Yeah, let me just I think Jefferson, when he comes on, he can let James know, so he can reinforce his question. But to the point, healthcare workers are not appreciated in Liberia. That's one of the deficiencies we have in our country. Nurses, doctors, they are not actually paid to the top. Okay, and that's one of the prominent issues we have in that country. All right, the people that save our lives should be prioritized when it comes to compensation or lucrative or earnings in a country. Okay, and until we realize that, we're not going anywhere with this. It will be very, like, so, not fair to them. For me, it just, I want to, if you earn the entire world but you don't have a good health, it useless or meaningless to you. So we have to actually respect our nurses, doctors, healthcare professionals, and the CNAs on the side. We've got the nurses, aides. So we have to get these people to get some lucrative compensations in their efforts, in their contribution on the services they provide for us to be on our feet, to go to work, to do whatever we have to do as a people or as a nation. And until we recognize that, we will not take any giant step to prioritize our healthcare. That's just one of the important deficiencies that we have. Until we can
Jefferson, I
honor
think
the
he's on there.
services,
Let's
until
see.
we can respect their services and pay them the money they need to be paid for their
No,
services.
he's not on.
Okay. Uh, he's
No, he's not on. I think we're getting feedback from
Let's
him. General, is that you?
The,
Okay, he's
yeah,
on.
let's
Yeah, I
put him.
think, yeah,
Yeah.
he just joined you. Yeah. Doug, I think he's in a noisy. Let me mute him. He's in a noisy area. Yeah, see you.
yeah, yeah. I just wanted to add to what Chris was saying. Are we there?
yeah muting Jeff. Yes, until we can do that. Yeah, Andrew, I'll soon give you the mark.
Mhm.
Until we can do that as a nation, as a community, we will not actually be moving any, we will not be making any significant strides in our efforts towards our modernized healthcare system in Liberia. We have to first of all prioritize and respect and pay the healthcare workers with some type of decency, type of compensation for their services. Okay, then we can see the need as a country, as a nation, to say, well, these people been doing this, they're doing this, and we're paying them this. This will give them some type of motivations and encouragement and stuff like that. Then we can move forward to the building the facilities and providing the equipment for the advanced treatments to be conducted in those different facilities that the government will undertake or build. So in order also for us to do that as a nation, the government has to reach out to private institutions to help, and the society as a whole, to see how we can make this system a modernized system to be able to compete with. I'm not saying the Western world. Let them go too far, but nearby countries, the Guinea, the Sierra Leone, whatever it is, we have to tap in our ingenuity as a country to prioritize these things. That's the only way we can move forward. So yeah, Mr. Kear coming. I'm done.
Yeah. So, compensation for services you render is something very key. Even around the world, before even a man or any professional applies for a job, they see the job description to see whether their skills meet that. One of the key things that they also consider before even taking out a particular job is about how much am I being paid for that job. Now, no one walks into a job, say you are being paid maybe about $5,000 a month, and then you go to see a job that pays about $2,000, and you go to apply for that. It's just not easily possible, because it's about your responsibility that you have, and how do you pay for the responsibilities you have, with your skills that you are going to provide. Now, in the Liberian medical sector, I would also think that the government of Liberia, as much as, I mean, that's the public sector, but in the private sector, Let's do a review of the level of compensation to medical practitioners. We have to look at that. And in fact, it's very key with respect to how dedicated and how committed that medical practitioner is going to be when compare when the market price is reviewed.
Mhm.
Maybe in Firestone, or maybe in LAC, or maybe with another private institution, or then the government of Liberia. People, you got to see the market rate with respect to compensation, because that alone is another driving factor that either will keep that manpower at your point compared to where they might be going. It might not even be Firestone, but also maybe, say, maybe in West Africa, other medical institution, maybe a WAU. A medical doctor sees exactly how much is being paid out there, and his country is not providing that. He goes to go and work for that institution. So the issue of wage and salary administration is very key in any society. For our public sector, the government has to step up. It's not only the medical sector, but other sectors for that matter, to see exactly how are things going with other similar sectors in the private sector, how people are being paid and how people are being paid in the public sector. Those are things that drive, the mutation of manpower. You got to be able to watch these things and create some balance. So when our healthcare practitioners are not paid well, most of them have their own little businesses like
Mhm.
drugstore or clinics. Guess what? They tend to divert even the services that's supposed to be going elsewhere to their
So
to their
they're cleaning.
institutions. So now you have government competing with a lot of the proliferation of medical institutions, even as to what they do at their level. If it is even substandard, who do you blame? You blame the government. You
Yeah.
blame the government because they have not been able to set in control measures and quality service delivery and even compensation to medical practitioners. So when we are doing these things, as much as we are trying to diamond maybe the level of service delivery by health practitioners, we also have to leave this concern to the government of Liberia that, look, as to how you pay your people determines a lot of things. It determines the commitment. It determines exactly the kind of culture and how they're going to be responding to things.
Yeah.
Your take-home pay should be able to take you home. If your take-home pay cannot take you home, trust me, my dear.
And that's the point, right, Mr. Kear?
Yes. So
Some of the healthcare workers, some of them making like $500 a month. I learned $250, $500 a month.
Yeah, recently, recently, there was, in fact, because they wanted their names to remain private.
Yeah.
Some of them were making at least 150,
Okay.
150,
Can you imagine?
135. Yes,
Can you imagine? That's a
in Liberia,
disgrace.
yeah.
Oh my.
That's a disgrace to our healthcare system. Then we get we have lawmakers making 10,000 or like 10, 15,000 plus.
Yeah.
Somebody that takes care of your health.
Yeah.
You pay them $150, $200 a month.
And that's
Mm.
where I have problem. I have a serious problem with that. The question will be, what is the priority? How is government looking at all of these structures with respect to wages and salary administration? You got to ask yourself, the one who you paying like $20,000 a month,
Yes.
where in Liberia,
Doing what?
doing what? What
Yeah.
is it that job is bringing on the table for the government on a monthly basis?
Yeah.
Say maybe a councilman, maybe a legislator making that amount. The question will be, now tell me, what is this gentleman who's being paid this amount is bringing to the government revenue on a monthly basis compared to the health service delivery?
Yes.
I mean, it's like trying to look for income for privileged few.
Yeah.
Privileged
Mhm.
few over the majority of the society that is going through a lot of tough time.
Yes.
And
The,
then you have
the salary disparity there is
Oh,
a
God.
huge gap.
and then you
It's not
think
even
that it's
comparable.
going to be a focus. It's not going to be a focus in the medical sector. All of these things have to be reviewed We have to look at the functions. We have to look at what it is that it brings to the table in terms of revenue stream for the government or sector by sector to know exactly how you compensate your people. So I think we are undermining ourselves.
Yeah, the thing that Andrew, to your point too, right? Let's just say that a lawmaker is going home on his way home. He had a cardiac arrest.
Yes.
Where he's going to
Yeah.
go? Where they going to take him?
To the hospital.
His whole life is going to be, hanging on somebody who are getting paid the bare minimum.
Yes.
He's taking paid $15,000-$20,000 a month. Somebody taking him $150,000. There's no comparison right there between the salary disparity right there. But your life is going to be hanging on this person that is barely making anything. That person is not satisfied for the services, for how much they're getting paid for the services, and you're going to want to be left right there and die. Everything you have worked for because you have not prioritized healthcare, something of that nature, the minimum of cost, what will kill you. You can get out of it because you did not prioritize healthcare. If something happens to the president of that particular country, like cardiac or some type of surgery, major surgery to be given, you want to think you're going to fly him out of Liberia to carry him?
I know.
He's going to die right on the plane because you guys failed to prioritize healthcare system in Liberia. These are just basic things that we have to put in place, guys.
Yeah.
Your health. They call healthcare for a reason.
Interestingly, government in, government out, the campaign for increase in health workers' salaries. So we go out years in, year out, year in, year out rather. You still experience the same thing. And like you said, right? I want to agree with everything you said. You do not get motivated to some extent.
No.
If your salary, like if you calculate your expenses for the entire month, and then your salary cannot meet your expenditure.
That's a stress myself.
Of course. And so if considering the increase of transportation in Liberia, before you take your transportation from there, the children's school fees, your own maybe to the home, to your family. If you subtract all of those expenses you have to undertake, you have nothing at all in your pocket.
It's
so
incredible.
You have to you then question yourself, why are you doing this job? Why are you involved into this? Because if you cannot make anything for yourself to get proper, to even save something or to even cater to your basic needs, then it's a problem.
Yeah.
Then that's why you see, like you said, you found the corruption in the health sector.
Yep.
That's another aspect of the whole thing we're going to be talking about. Because if you do not pay someone the money for the work they're doing, you don't pay them according to what they do, their degree or their qualification. Next thing person want to do is if they can find some loopholes to get something from the clinics or from the hospital that you provide medicine and equipment to, they'll definitely have to take it.
Definitely.
Sometimes they really have to take bribe or to ask patients for money to be treated. If they don't have to pay the money. Like for example, if you go to redemption, sometimes they tell you you're about a quarter for so imagine that if you are underprivileged or you are poor, that means you will not be able to get the kind of quality of health service that you also get. Because you cannot buy a single soft drink or cold water for a part-time nurse who is also take care of you.
Yeah.
So the problem is just like it's a perennial problem, and it keeps repeating itself. Almost like we're just seeing a repetition of history. Everything that happened in the past, we just keep repeating them, and without any sign of improvement. And it's really bad for us.
Even though when you go to those hospitals, you see the signs are visible, the inscriptions are there. Services, free services.
Yeah, free services.
Though it's free. At the very place you see free, they will be telling you that you have to pay this, you have to do this. And the thing about it, once you go there and you do not have the money, nobody will look after you. The doctors, the nurses, they will not look after you because you cannot afford to give somebody or to either bribe somebody and say you need to give me this.
That's a good
imagine someone be on a very critical condition, right? They go to hospital right? The hospital administration would rather prefer the person to register before
Before.
that patient is being attended to.
Oh, yeah.
So why if you are at a point of death and then you need urgent attention? When they'll tell you say when we got pay $4,000 before we so you can go tell that patient. And if you don't pay that money at some places, they will not touch you. And if it come for you to die there, you will die there.
I just said.
So yeah.
Yeah, open the lines in case anybody wants to contribute.
All right, so this is the conversation of the CEO here on Kear Radio, FM 95.9. For those of you who've been following the show, the numbers are active now. You can start to placing your calls on 0770 573 477, 0770 573 477. The Lone Star line is 0881 871 670, 0881 871 670. The WhatsApp line for those of you overseas or you follow us on Facebook, you can use 0886 681198. Let's go to the line and begin to take calls right now. Good evening. Yes, good evening. You know where you call from?
Yeah, I'm Anthony Crawford calling from Florida.
Anthony, welcome.
Thank you. Yeah, I'd like to say thank you to the CEO and the panelists on the show. You guys are the health thing out is very bad. Really, the health practitioner, the one who has reached overnight, you can provide all the equipment, all the necessary hospital. We will still corrupt the system. Every one of them has their school or clinic, no black bag, and we will be open. Absolutely, we could be medicine with the clinic or hospital. When we leave from there, all the big kids in medicine go in.
Wow.
When we go there at the end of the day, no treatment, no medicine, and die any medicine. And it is bad. So we really want the government to help us, these poor people, for us to get our necessary treatment because we are dying of so much diseases and these things. Okay, well, that's it. My lawyer taking key of the phone with it.
All right.
You say what's your name?
Thank you, sir.
Okay, Anthony, let's go and take this other person right here. Good evening. Let's hear you, Evie.
Yes, well, I want everything for the topic. But what you're discussing is every actually when you also in that area, the GSP. This is so not to get it, but then they will say they will go away on people and they go bad. So not only that, we get out for nothing. Yeah, I think I'm very taking for
Okay, thank you so much.
Thank you.
Okay, Mr. Carver, thank you. Let's take this person right here. Good evening. Yes, you're live. Your name, where you call from?
I'm looking at
Get ready, John from Peace Island. Let's hear you.
I have a problem with the hospital. Actually, the real hospitality of me is the hospital. And whatever we do to the hospital, if we anything the hospitality doesn't do. Let's imagine if you last week, my woman was in the hospital and care like the person that doing the operation. And the thing is talking 200 people out here. So I've been talking to the president, figure out and they said no, it's a bigger profit. So when we said profit out, we said well, I said no, it's making a profit. And they called me to go there and say you need to get a little work on it. I went there. While they were going to do the operation, all they did is work there. While they give me making and we get people in the hospital at the end of the group, the people charge a normal $10,000. After they justify the money until they add another $12,000. So that money making it $52,000.
Wow.
At the end of the group, You have to watch. Every parliament or not just having to be more than every day. We try to put it where to get to the doctor or to get to the body or
All right. Thank you.
yeah, now I want to get to I have a story get to. Because I said I get to get every day. But the people there now every day will be 20 hours worth people. You see it. If you can't buy the order, you buy the thing, get to get brand there, you get to the money with the brand there. Then it's going to be people that get out of there, you get to get.
Wow.
All right.
Thank you.
Thank
Thank
you
you so much.
for your points.
All right. 0770-573-477, 0770-573-477, 0881-871-670. The WhatsApp line is plus 231-886-68119. This person, good evening.
Yeah, good evening, How are you?
I'm okay. Any more you call from?
I'm good. Now, to this now,
Let's hear you.
yeah, thank you for the prayer. We don't have to be a flesh on the air. It's question. We have to say, like, yeah, man, can you imagine? Because of future people in making us sick. People go to the hospital and see the sickness, it's very serious. Because what we now have, I think now, because of future, you go to the hospital, you go to paper. And if you find a place for the body to if you have the money, the people will do that. You have to say, yeah, but
Okay.
clear, that God bless you. That God bless you. That's funny and long. Thank you very much.
Thank you so much. This person. Good evening. Good evening.
Yeah, good evening.
Seku Fofana.
Thank you.
Welcome, my brother.
Thank you. I don't know whether that
Yeah.
I don't know whether you have to kind of time you need to Sunday.
Yeah, it's every Sunday, beginning 7 p.m. Every Sunday, conversation with the CEO. Yeah.
The medical facility, the what we can take to protect life. We're not doing it now. I have experienced that between years. We need to administrate by every good I think now when you put out years. But then what have you done? You see, the thing is the money not crowd will never take my own. Before starting up your operation, the prescribed medicine was with the doctor that I think I was thinking that I came out with it. I was surprised I wanted to get to the study that year. I think from there, you know, after every you see the get the bad medicine and the put out. So I do the medicine there. And that's about good out though. When you give me like the medicine, put the medicine out.
All right. So good. Thank you.
Okay. Thank you, my brother, Fofana. Seku. This person. Good evening. Mohammed Kane from Balaswa community.
And all of the Kear family didn't have money to our women looking from the diaspora. You know, I followed the CEO and the king and the prayer for our who asked for legendary
Okay.
you know, our health situation in this country, and I would say, that is very much poor. Yeah. And that's why you see some of our government officials, I want to say, it is not extent, or nothing, just a 90% of them on the street. They always show them all of the country. Yeah. And it was put in the late Democratic Senator where was another one of person lying down at any other working towards never clinic or stay will pass or see. But our health system, our health system in the country is very much poor, very wonderful.
All right. Thank you.
Every someone to do it, we can do a research. If you have hospital, if you want to know, see what I'm they from photo, they from part of work, very more work. Because every medical thing that we need, we declare stage, crop, then the crop, you have to back crop, you have to buy $2 thing, so what? It's very more frustrating.
Okay.
Let me say things because other programs, and I think the care radio, every Sunday, the way they feel they come on with different health education platform on the program. Let me say thanks to him. They know they want to be very progressive. There's a care, critical therapy, it was very much in my domain. I think all on the blessing. All of the foundation never than established. Let God bless the care foundation, the care family, including the care, all of the staff that are working on it. God bless you. Because if you tend to do something wonderful for me, I'm a teacher in their body. So let God bless everyone.
Thank you, sir. Thank you.
Thank you, sir.
Thank you.
Next. All right. We take more calls. There's 0770 573 477 0770 573 477 0881 871 670. For those of you in the diaspora, the WhatsApp line is +231 886 681198. While we are with calls, CEO, General, Mr. Kear, listen to the callers.
I mean, just what we said, right? The same that I just said this in less than 5 minutes. Prioritization on healthcare workers. This will actually be the reasons, or some of the reasons that these people will not want to take their job seriously. Corruption will be actually infiltrated in the service, right? So we can compromise. This is just
I think we have a call, CEO.
All right, go ahead. I'm sorry.
Yeah. So, calling from where? Peace Island. Okay, let's hear you. Go ahead.
I attached my document to what I feel now. I went to the hospital in it. I have updated to my nose. I fell from the bed. I fell down. The nurse that was around me, not to who care of me, she was facing all of the people. She now look at me, all these people on her bed. She took me in the house. And then she got my own bed and my own foot. She got me into the chair and she that was there on my nose.
Okay.
Okay. Thank you so much. Let's get this other person right here. Good evening. I'm okay. I need to know where you call from. Joseph from Ghana. So let's hear you.
My brother, I want to ask you the rules of what a ministry of health, ministry of health, they are not
Those who work at the ministry?
yeah.
Well, there are different people there in different departments. Not everybody there is a health practitioner, though.
Yeah, but when you tell ministry of health, they are not part of health.
They are. That's what I'm saying. They have different departments. The communication department, you might not necessarily be, but go ahead anyways.
Actually, I want to come to the issue now. Because for
your line is broken. It is breaking. We're not getting you. It's terrible. We're not getting you. You got to shift a little bit.
Okay.
Go ahead. Go ahead.
Okay. That is no issue from our city administration. So, office staff are very struggling for transportation. They're very fighting. You see, now the budget that they got, the people draw for the ministry that there are no few. And even now, my brother, it's not just for the health workers that ministry of health sector office. But now, small things that struggling and we go over and over meeting the minister and nothing doing for now. If you for the last 6 years, we go through it and now we still go through it for the past 1 year.
Oh,
So nobody are talking about God. Even the increase of the salary, when they say health about increase, man, it can't be expect one of the message of the doctor so that to reach to our mission.
Hello, sir. Are you a health practitioner?
No, I have a benefit that we came about evolution and I'm not seeing it.
Okay.
Yeah.
All right. Thank you, Father.
Thank you for your concern. Thank you so much. Okay. Yeah, he struck a point, Mr. Kear.
So, let me just come in quick, right?
Yes, Kear.
So, we all seeking extension. It's a very, very, like, it's so deplorable. It's so shameful, man, to see the huge salary disparity in our country there. Okay, and expect these people to work honestly, save lives, and perform miracles. And like they're not getting paid; they're really getting they're underpaid. So, well, how much how much more can we expect them to do? Or all of them, our government is actually they prioritizing their services in these representatives, senators, and ministers, and things, other positions. For the people that save lives in the country, they don't prioritize. The salary have been compromised completely, like almost like what can I say? Let me compare it to the housekeeper. Housekeepers in the country, yeah, how much they make? $150, $200 a month or whatever it is. That's nothing. That's some of the government officials. That's some of the gas money on a daily basis or a week. Or a couple of them, like, it's so deplorable. And until the country or the president or the government can realize this, the huge gap in salary disparity, we're not going anywhere because at this point they're showing to us that they have not prioritized healthcare at all. If some of these doctors, some of these nurses were making the five, if they say the government official, the senators, representatives, they're making 15 or 10,000, whatever, I don't know how much they make, but 10, 15,000. And these doctors in the hospital, some of them are making like 7,000, 5,000, nurses making 3,000 or 4,000.
The sector will improve.
It will be really, like it will be very fair, and and we'll see the changes. But the money just being in, like, if you don't work for government, you can't make anything. Like back then, nobody wanted to work for government. People prefer to work for in the private sectors like Lamco, Firestone, and other companies.
Yeah.
But nowadays, if you really want to get rich overnight, go work with the government. In less than 5 to 6 years, you become from being homeless, you become an overnight millionaire.
Yeah, Marshall.
The people that save our lives in that country, we don't value the services. They're underpaid. Okay? So until the government can identify that particular area, we're not going anywhere with this. The people have to be, paid to some extent in the way the government officials are being paid. So go ahead, Andrew, if you want to put some comments in
there. Here we all tend to advocate for the health professionals or practitioners when it comes to the issue of compensation. We've talked a lot about it. I just want to switch it from another little perspective. I know time is fast spent, but I might want to say, in the face of all of these realities, low pay, low salaries, and but that should not, and this is a caveat to all health practitioners, you should never ever try to compromise your your profession, and your value, because of low pay. Mind you, your profession comes with it a level of compassion, a level of saving life. You are one of those whose services cannot easily be compensated for what you do, especially in civil life. So I agree with you. Our system is corrupt. I agree with you. Our government has not been able to streamline the level of wage and salary compensation. I agree with you with all of these gaps that might be coming from the government side. But you also have a moral responsibility of saving life in the face of this. You cannot compromise your profession and your value. You got to ask yourself, what do I do to make things better? Is it because others are doing it, so you have to join them? Now, if others are doing it and you are joining them, you are just becoming like one of those apples that tend to spoil the rest of the value of the medical practitioners. So I would think during these critical times in our society, there is a call on all of us value and the ethics that are required of us. So you have to step up and create that distinction in the face of it all. While we are advocating, while the government is also making efforts to bringing about some equity level in the compensation system. One of the callers said something. He said, you can provide even all the equipment, whatever they need. The same people will still do what they are doing. Now, mind you, what that speaks to also is about looking at the oversight, or what we call leadership and accountability. Now, in the face of all of these things, we expect also the Ministry of Health and other sectors to consider the issue of oversight. If that responsibility is given the sector in terms of maybe drug supply and other equipment or how it should be used, it is incumbent upon that leadership level to be able to streamline that leadership that is required. We look at also the regulatory bodies, be it the pharmaceutical board, as to how things are being done and how drugs are being dispensed. Are the practitioner doing what they're supposed to do, or are the community programs and other health practitioners, are they doing what they're supposed to do? Now, if you do not streamline your system, if you do not monitor your system, you create loopholes, and these things will go on. And at the end of the day, who become affected? It is the citizenry that become affected. So oversight and accountability are very key in the process. We have to look at these things. We also have to look at the issue of capacity building. Capacity building is very key. Look, you just do not learn for learning's sake, and then when you will be doing something different. If you are being told as to the ethics that are required in the medical field, and you are going to be employing something different, you have already defeated the purpose. So this is in two ways. We don't have to be followers. We don't have to. You got to be yourself in the field of low pay until the government can get there. You went to school for a purpose, and you should be coming in there with that professionalism, because even because of you, others, if you do it right, others will be able to also follow you. We should all be the preachers or the John the Baptist in the wilderness and trying to preach. That's what we're supposed to do in this health field. So I get it. The government is not paying, or people are not being paid right, but that should not make you to sell your soul to the devil. That should not make you to compromise the professionalism that are required from you, the ethics that are required from you. So these are critical times in our society that I think we all need to step up. We all need to play a role to help in the society. We all need to play a role to help in the government. We all need to play a role to being able to reform and refine the image of the health sector. If we do these things, it go a long way onto your own family, onto your own profession, onto others that you tend to also make you to look up to you as an example. So I think this is my call to all of those, in a medical field, that it's a two-way street. You play your role, the rest of it will play itself. Thank you.
Okay, so indeed, exactly as you said, Mr. Kear, that's just it. Government just need to beef up the strength out of more, especially when it comes to the budget of the Ministry of Health, so that it can be shared adequately to other parts, especially in the rural parts, because those people over there, they really find it difficult. I mean, sometimes you hear from the Telewian Hospital in Lofa County, doctors who abandoned this because of low salaries, they're not taking paid, and there's no equipment, and all of those things. It is not the doctors or the nurses who will feel it, but the ordinary people, the ordinary citizens who are there are the ones who go to. Because if doctors are not paying attention, if the patients, imagine patients on bed and doctors abandon the entire clinic or the facility. Who are those that suffer? Is the patient, because you're on oxygen or so, and then nobody's looking after you.
Yeah.
So it is the patient who suffer it.
And
so
that's it, right there, Jeff. That's it. These people, they to get better healthcare, they travel out of the country to get better healthcare, but the citizens there dying in this type of poor healthcare system. But for the ministers, the senator representatives, they get sick, they fly right next door or come in the Western world and get some help. That's not right. And it's crazy. Yeah, let's think. I think we have to wrap up now. Let's do our
we got we're going 2 hours 1 minute. 2 hours 1 minute.
Let me just reinforce this. So to all the callers, I don't think we went past 20 callers. So
we got 1, 2, 3, 4, 6, 7, 8, 9 calls. We got 9 numbers here. I took that 9 numbers.
All right. So you can.
So there's a call coming in. I don't know what I can still take it.
Yeah, go ahead. Guess we're about to close soon. So.
Okay, so let me get this person through. Good evening.
Yes, sir. Good evening, sir.
Yes, your name and where you call from. Hello? Are you there? We're not getting you. Let me use this. Go ahead. Yeah, you're live.
Yeah, I can't get my family from Kear.
Okay, from Kear. Let's hear you.
Yeah, I would appreciate more for this program. Not everything because it is very, very educative. Sector is government challenge.
We're not getting you. Yeah, see you. So he dropped the line.
Yeah. So guys, so we're about to wrap up the show for today. We can if you have call coming, let us know. We can pause to take it, okay? But we'll be wrapping up soon. So General, you have anything to say?
Yeah, no, I just listened. I'm sorry that I never participated, but I listened to everything and what went on. Like my brother Kear, Andrew said it all. It's good that we have this show. And
General.
Yeah,
go ahead.
Go ahead. Let's hear you quickly.
Yeah, I'll get out challenge level issue.
Okay.
Yeah, so as I said, our health sector is complete challenge. Obviously, they have supply all the facilities. So the weather my first time calling the issue.
Okay.
Yeah, the first one. So obviously, they have supply all the medical facilities, medical supplies. You see? Well, I don't know if this is happening. Why do you cannot see all the money they pay?
You say what?
Why do you cannot see all the money they pay?
What is that's a
good thing. Like steal the money, right?
If they steal the money, go out of the country, no matter what you say that.
If you get someone that needs medical facilities, now you have to stay on the trouble. So you can question the court. You do the weapon shot. I think the killer is going to do the oversight.
Yeah.
No, that's a fact.
Yeah.
Okay.
Accountability.
Thank you so much.
Thank you, my brother. Thank you.
Thank you very much. But yeah, medical support. Yeah.
Thank you.
So,
I said, tell us to steal the money.
so
Yes,
Jeff,
yeah.
Jeff, you can reach out to all the callers I called today.
Yeah, so I have 10 numbers here.
So next week they will not be allowed to call on the show again. So it's not every week. It's just new
Okay.
callers.
Okay.
No,
So
Okay.
make sure you
but,
keep those numbers. Prepare them
Yeah.
because people
but
are
what if
very
they have
crafty.
other good points to come in next time?
Well, I think we got to make them to call. We got to make them
Yeah.
to call
Yeah,
next
but
week.
I think
they
they
can
can
call. They
call.
can
Maybe,
call in, but
maybe,
if you call before, you're not gonna get the $5 or
Yeah,
yeah,
something.
yeah, you
maybe,
got
maybe
your
the
boss.
$5 is too much. It's too much. So next week we'll make it to 500 Liberty for anybody who call.
Oh
I
God.
think the
No,
five
no,
dollars is
no,
too much. That's why they're not
No,
calling.
no, y'all keep the
no.
Uh, the
Yeah, I think so
the
too. Maybe
500 Liberty will be better. They love Liberty because the thing is
Yes.
that they have the opportunity to call, but some of them, I see some people texting me and saying what the
Yeah.
number when they're watching. They do, I don't know how they expect me to
Number
show
is on
them
the
what to do.
screen. The
The
number
number
is
is
on
on
the
the
screen.
screen,
this is
and
the
if you're
number
not
can pass
listening to
fast.
radio, you got internet with you. The number is right there, and you want me to do what? I can't help you.
Somebody said
So,
the number is passing fast.
so I don't know how they
no.
want us to do it.
Yeah,
But
but
that's
yeah,
it is what it is. And it
yeah,
was a
but
nice
guys,
show, and I
it's
see almost 400 people watching us.
it's
Just looking at
it's actually
record.
it's a serious issue we have on our hands, man. We have to, like next week we'll continue the same discussion. Let's not go further. So
Yeah.
anybody wants to, do a closing, you can go ahead, Mr. Kear, if you want to, or anybody in studio.
Okay.
Yeah, so for my
This
end,
will be the
I
last.
just. Oh, okay, okay, okay.
Okay. So, I want to thank our viewers today who've been there out there listening to us. The issue of health remains a major concern as long as we live this life. All of us want to be healthy, but the society in which we live in Liberia, if the government does not create the room, for a healthy society, like I've always said, the government is setting itself up to be fully undermined to have a very unhealthy society. You cannot focus your how you call your allocations of resources to just privileged few. You cannot. You got to look at your sectors by sector, especially the health sector. It serves as an engine, and so that's one area that we need to look at. So, of all of the problems we've been talking about, we're looking at the issue of being able to strengthen the oversight of the health sector and ensure that accountability is followed. If we do these things, trust me, we will be able to empower, the regulatory bodies to monitor, compliance in a very rigorous manner. But if we sit by and just look at things, everyone is going to be a chief and there will be no Indian in the system. Everybody will just be doing their own thing. So we also talk about the need to implement accountability mechanism. Government definitely has to establish that clear accountability mechanism that will be able to address the breaches. We talk about people taking medication home, maybe from the drug agency, and taking all of these things home for their own private. If there is no accountability mechanisms put in place, government stands to lose every day. They stand to lose everything that is there to benefit the people. We also saw the need that there is a need to improve the resource allocation. Priority has to be given to the health sector. They have to increase funding. We talk about it, and that's something I think is very key. Uh, Government must be able to look that way. One of the key things we also that I jotted down had to do with also the enhancing training and and then the professional development of the people. If folks on a on a periodic basis are trained and are reminded of gaps or things that they are not doing, trust me, it's just like going to church. Every day, if I listen to a sermon today that tend to speak to my sins, I will definitely tend to buckle up. So it is with even in our own health sector, what we do. If if those ills and gaps are being pointed to like we are doing on the air right now, and callers are talking about it, and then we go to train our people that these are gaps people talk about. This is how well you're supposed to be here. When people hear this, get this training on a periodic basis, I think people are going to buckle up. We One of the things we also talk about had to do with the patient care and the communication. I would think that just even with the malaria you have, as to how I engage you and speak to you as a health practitioner, that in itself can save a lot. They're coming and thinking that you are the boss, and without me, I can't live with my illness. I'm already burdened with malaria and other challenges. But the way you tend to engage a patient, that communication level, that assurance, is all that they require. It helps a lot to be able to solve most of the problem. Um, so one of the issues that I think government should also be be able to do, that we also talk about, had to do with working with community programs. The community programs, if we work with them, trust me, they serve as how you call a partner in progress, and they meet us halfway. They tend to also recommend to the Ministry of Health some of the things that they need to concentrate on. When we have that partnership approach to health delivery, there's so much that we can do, not only in Monrovia, but in Cape Mount, in Bapolu, in Lofa, in Maryland, in Sino, and in Nimba, and the rest of the hinterland. Government should be able to listen to some of these queries that are coming out. The Ministry of Health should pay more ears to the criticism and use the criticism to be able to change a lot of things around. This is a work in progress, and I would think that we should be more thick-skinned in terms of what is brought against us to be able to move forward. I trust the Ministry of Health, especially the leadership of Ministry of Health, Honorable Dr. Boto, and even the president. And I want to also commend him about the speech that was delivered, with the health component of it being more emphasized. That we only look forward now that the government will be able to walk its talk. The media wing should also be able to hold the government's feet to the fire. Work with other institutions to highlight most of these things so that they see exactly where they are and where they need to go from here. Thank you.
Okay.
Thank you, Mr. Kear. Thank you.
Yep, you said it all, kid. You said it all. We can't add anything on that. Sio, you're coming, Sio?
No, I say thank you, Mr. Kear.
Okay. So we'll turn it over to studio. We want to say those of you who listening by way of radio, we expect you to call, be a part of the show, and share the show. Share it. Go on Facebook, YouTube. You can subscribe on YouTube. You can follow us on Facebook. Just put in one word on Facebook, Kear Network. Very easy. On YouTube, it's Kear Network, and you can follow us and subscribe. And for those of you who call today, well, you get yourself $5 tomorrow, or so you can come to the station
Wednesday,
there.
go to the station on Wednesday because you gotta give it
Wednesday, you will, yeah, every Wednesday, yeah.
Yeah.
By Wednesday, you can collect, and next week, you don't know what might happen next week. So we want to appreciate you, and to those of you who are on there. And Chris, what his name? Jeff, please try and bring the guy in if he can come into the studio.
Yeah.
And see how best we can straighten up, because he stressed a lot of good points that we can take. Yeah, he made some key points, and man who running a clinic too, he know most of the things that they're going through. And I want to say thank you, Andrew.
General, let me just say one or two things to what to in connection with what Mr. Kear said earlier. Our conversation has been very helpful and educative, right? But in order for our government to be on the path of creating like I always said, creating the healthcare utopia that we all dream about in Liberia to see it in that particular country, it has to first of all be identified. The government has to come in place and say, listen, we have to do better, and maybe appreciate the healthcare workers, give them some type of lucrative earnings, uh, and that can be the beginning of what we want to go from where we want to go from 0 to 10 or 100 or whatever. But what I'm trying to say here is, if somebody has a crisis, they have that drug problem, you want to first of all identify the fact that you have a problem and seek help. If the government cannot come to say, well, this is the situation, we need to first of all appreciate our healthcare workers and pay them to some type of degree. This will actually curtail the corruption in our healthcare system. Someone who's taking care of you, they don't need to actually worry about how much you're going to get paid. Because if the care, if the services they're rendering to you is not at the top notch, you risk your life. You risk your
Sure.
life. You're not dying. So these are things that we have to put in place first. Okay. Then if we identify that, then we say, well, what can we do for these people to have a good environment to work under? Then we'll start to develop the institutions, the equipment and things that will be purchased for these doctors, nurses, and aides to work in these facilities. Okay. So that's all we have to do. But until our government can identify the fact that these people need to be paid and appreciated, we're not going anywhere. That's just what I wanted to add there. Okay, so you guys can go
Sure.
ahead.
Okay, thank you, Jeffers and CEO. Thanks, Andrew. We
Yes, sir.
can when I come to the end is we went 2 hours 16 minutes, which was not bad at all. We
60
thank
minutes
you.
above.
Yeah.
Yes, we went 16 minutes extra, but hopefully next week it will be a very good show. We still need to get people on. We still need to talk. I forgot I never send you that photo numbers. And if you're listening to us, Doc, we need you. You need to come on. And by the grace of God, maybe next week we'll get Dr. Victor Kaiser from the Jackson Doe Hospital. They will give us all these things. Oh, we're coming, but then later on when you look, they just change it. But he said he'll be
Everybody afraid the thing is a trap.
yeah.
No,
This
but
is not
Gerald,
politics.
I want to be very, I really want to assure you guys, Dr. Boto is a blessing that we have, a very, very progressive lady that I've known over the years.
Who is she?
Uh,
The
Dr. Lucy,
minister,
Yeah,
I've known her
the
over the
minister
years.
of
What I will say
Alicia.
to you is that
health.
the challenges on ground are being carefully managed, carefully monitored by the doctor. She is going to deliver, and the president has that very explicit confidence in her. And some of us do know her and know what she's capable of doing. Rome was not built in a day.
Right.
Dr. Boto is someone that you should watch carefully. She's going to make the difference. With
Okay.
all that we are talking about, she's one of those who listens. She's been a very great leader, so I know her, and that's why I am not so deterred by what we are faced with in terms of healthcare challenges in Liberia. She's one of those to help.
Okay. Thank you so much.
That's
Studio,
good.
you have
CEO,
Yes.
anything?
take it from there.
Okay. So thank you again to everybody who followed. James, you want to close before I can wrap up?
Yeah, so I just want to say thanks to all of our listeners and those following online and things. So thank you so much for following. This is your informative platform for health discussion. Let's come and talk about health. As people can say, your health is your wealth.
Yep.
Because whatever you do, no matter how you work to look for money, to do whatever you want to do, you don't have good health, you're not going to enjoy the money you want to enjoy. Or, you're not going to make use of the money that you make. So let's discuss our health. Let's, have this discussion to recommend to the national government to play our part as as citizens of the country, so that we all can have a wholesome, functioning society. Thank you.
All right, so James, that's it, folks. That's how we come to the end of today's edition of Conversation with the CEO. It has been a wonderful one here today. You can join us on next Sunday when we will be here again. Hopefully, we'll bring in uh, doctors in studio. Some will join us online so that we can have an in-depth conversation on health matter. Thanks to you again for listening. Thanks for those who viewed us via the social media, Facebook and YouTube. My name has been Jefferson. We will be here again next Sunday. Have yourselves a blessed Sunday from Monrovia.
Thank you, everybody. Good night.